This is the morning brief from the Economic Times.
Doctors and nurses are overworked. Hospitals are struggling with a shortage of beds. Medical oxygen is scarce. Intensive care units are full. And key medication required for treatment are unavailable.
Just when we were picking up the leftover pieces of our lives after Delta raged through our families and friends, a new variant called Omicron has picked up pace. The oximeter and the thermometer is back on the nightstand. Stay safe and get well soon messages have replaced all New Year wishes. And most of us are cross-checking the curfew timelines and if there are sufficient medicines, groceries, and hospital beds all over again.
That Omicron cases are rising much faster than Delta, from about a 2% share of total COVID cases 2 to 3 weeks back. It's now shooting up to 30% a few days back, and it's now close to 60% of all COVID cases.
While authorities and medical fraternity are warning of a deluge of cases, there is one question we want answers to. Is India Omicron ready? And in today's episode, we will find out. I'm Devina Sengupta and you're listening to the Morning Brief from the Economic Times, a podcast making sense of the hottest stories in business, economy, politics and markets. My first call for this episode went to India's foremost virologist, Dr Gagandeep Kang, who explained the difference between Omicron and Delta and also did a SWOT analysis on how ready is our country to battle this wave.
So let's take a look at the virus first. How do we track the virus and understand what is happening to it? The most important thing is epidemiology, looking at the number of cases and where they are occurring, and rapid antigen tests, which have gotten better with time, and RT-PCR are tools that allow us to detect the cases. And then we want to be able to track the evolution of the virus, see if it changes. And for that, we need genomic sequencing or some sort of target that we can use to understand whether certain viruses are spreading better than others. If we have tools available to us and we are willing for data sharing, I think we will be better in as countries and as the world to understand the virus.
That's an important point you mentioned out there, doctor, that tools are available, but more importantly, if there is data made available, do you think we are doing enough to get this data?
Well, I think in India, one of my constant themes has been how little data is available in the public domain. I hope that we will do better in the future. And one of the things that's really important to understand is that we are continuing largely to use the same data at the national level that we have for the past 2 years. Some states and union territories, Delhi as an example, are doing way better now. They're sharing data on bed availability, occupancy, hospitalizations. These are the kind of data that we need for the entire country.
Doctor, you had mentioned also that Omicron may look less severe right now when you're looking at the larger group data that you have. But even if a decimal fraction in India goes to the hospitals, our healthcare systems will collapse. What can be the immediate steps taken to prevent this collapse?
So if we look at what happened with Delta, and Delta is estimated to be 4 times less infectious than Omicron. North India really struggled for a surprisingly long time whether it was with oxygen or with the availability of beds or, people rushing around for all the kinds of irrational treatments that were being proposed at the time. South India in general did much better. The larger cities did have some days where it was difficult to find beds and there were worries about oxygen, which ultimately didn't manifest at the same level as in the north.
I remember talking to doctors out there who said, East has had an oxygen surplus and they wish that there was better coordination between the states and one didn't have to grapple for oxygen.
So I think one of the things that became clear was that when oxygen was in short supply in northern India, because the bulk of the supply comes from the east, what happened was a situation where transport became the key barrier to access to oxygen. The oxygen is carried in tankers, and a train can only take so many tankers along with it. So a lot depends on trucks. And what was happening was that states were closing their borders and not allowing oxygen to transit through their states in order to reach places of greatest need. That's why the government set up an oxygen control room to monitor what was happening with oxygen across the country. Ultimately, it was not a failure of supply, it was a failure of distribution. And I hope that that won't happen again.
Right. And also moving away from the distribution challenges, our first move again this time is we have stopped the schools, we are barring certain flight routes. Sometimes it comes across as slightly knee-jerk because you are hearing that abroad schools are being opened. What are your thoughts on it?
I think you reach a point where you feel perhaps as an administrator, and this is attribution on my part, that you need to show that you're doing something. And shutting things down is a very visible way of showing that you're doing something. Kids have been out of school for about 2 years now. And I think it's very important to understand that what we see projected in the media about schools is information that comes from the West, where it is a lot easier for people to stay home and for children to be online and be able to continue to learn to some extent. In India, that is absolutely not the case. And we have to understand that sending children to school is a requirement for their development. This benefits them much, much more than the risk of their acquiring infection while in school. With Omicron, the risk of infection is definitely higher than with Delta or any other variants we've seen in the past. But in general, children who are healthy have much milder symptoms. And the important thing to emphasize when we think about schools is masks, ventilation, and making sure that children don't eat together as much as possible. These are simple, these are implementable, and we should continue to do everything we can to keep our children in schools and not have their education disrupted the way it has been for the last couple of years.
Shifting towards the boosters. Now, while we are still toggling with if same dose or a mix of doses will work as boosters, what should the public do?
You give a booster when you know that people are no longer protected by the vaccines you gave in the past. And what do you mean by protection? Do you mean protection from infection? Do you mean protection from severe disease? Or do you mean protection from death? Now, if you are only counting cases, we know reinfections will happen. But if you only count cases, it will look like vaccines are failing when they are actually continuing to protect against severe disease and death. But we won't know that because we are not counting the hospitalizations.
Doctor, now you also have those self-test kits available. I have also used one of them, in fact, recently. Do you suggest more of those tests being available?
Absolutely. I think there are certain situations where any responsible person should have the ability to test themselves before engaging in an activity. The advantage of doing these tests is that you save so much time in being able to figure out whether someone is potentially infectious or not.
Dr. Kang chalked out the benefits of physical education, home tests, urgent need for more data. But what are the government's thoughts on them? Is the center and the state government coordinating better this time? Do we have enough vaccines for both boosters and regular jabs? My colleague Nidhi Sharma detailed out the government's blueprint on what she calls India's third wave.
Nidhi, the booster shots are on right now, the age group between 15 to 18, and the second shots for many are getting completed right now. Is there sufficient availability of vaccines in India?
As far as supply is concerned, Devina, we are absolutely fine right now. In fact, India is exporting to other countries. And if you see in December, there were about 17 crore to 20 crore doses with the states lying unutilized. Because at that time, India had reached a plateau as far as vaccination was concerned. So that is why the priority groups were added for a precautionary dose, and the government opened up 15 to 18-year age groups for their first shot.
I think in your reports, you had mentioned that about less than 1% of this young adult population had registered for their first dose. What are we seeing? Is there any kind of vaccine hesitancy that is coming in even in them?
So the government expects this response. So when something is beginning, you really want to know what is happening to others. Are there AEFIs? So this was one of the reasons why the government took its time in introducing vaccines, COVID-19 vaccines in this age group. Though the emergency use authorization to Zycov-D and Covaxin was given, they were examining even other data from other countries and the response. If you see the world over, the children's vaccines, the uptake initially was very poor, and even very gradually it was about 1 to 2%. And then with a new variant of concern coming in the world, we saw the vaccination really picking up.
Drive for teenagers began on a high note yesterday with over 41 lakh doses administered to those between 15 to 18 age group on the first day itself. The daily vaccine tally got boosted again and reached 90 lakh doses on Monday, taking India's cumulative vaccine coverage to 146 crore doses.
Are you seeing better coordination between the state task forces and the center? What are your initial observations?
Delta, the kind of, it was a very vicious second wave. So it wasn't really about coordination. It was just about a healthcare system getting overwhelmed. Even in your developed countries, all healthcare systems get overwhelmed when you have such a big surge and, everybody is coming to the hospitals. At that time, the biggest problem that happened was nobody had seen the oxygen requirement going so high. So it's like witnessing something for the first time. So you can't really expect any healthcare system of a developing country to, match up to that. Though right now we see a government which has learned its lessons. We saw the phase between the second, and I now want to term it, though the government hasn't termed it, as the third wave. But yeah, maybe we can call it a surge in cases. This time that we are witnessing right now, from June to, say, December, the governments and the state government and the center have prepared themselves to look at anything. So there is a stockpile of essential medicines, ventilators, trained personnel for ventilators, and every district, the plan for every district having a PSA oxygen plant. Everything seems to be in place right now. So that looks fine. If everybody pitches in, I think it will should not see those kind of hospitalizations, and we should be able to tide over this.
Right. You had mentioned about the hunt for oxygen beds, etc. It was crazy. It was like a nomadic hunt. What is being done to prevent that?
So there is no central system right now, and there cannot be a central system to actually see how many beds are available. Devina, states seem to be better prepared than last wave, and the time between when India peaked in May, and then finally the cases started tapering off in June. So the time between June, July, and till end of November was actually utilized by the states to ramp up health infrastructure. For example, in Delhi, you have a color-coded system of yellow, orange, amber. If positivity increases to a certain percentage, the state shuts its schools, shuts its cinema halls. So all those protocols are in place.
There is mayhem right now in EU, in US, in UK. Huge number of cases being registered every day. There's also a South Africa which might have peaked and is right now seeing probably, and we are hoping for a decline in cases. When you're talking to your government sources, are they also in discussion with the other countries to understand what is happening?
There is a lot of data flowing in from all quarters. So data from other countries, data from WHO. So this kind of data, like specifically say hospitalization data from South Africa, it helps the government in framing its response. Like when we started getting Omicron cases, we started doing institutional quarantine in a way that even if the person showed mild symptoms, they were in a hospital, but that was to restrict community transmission. That was done then, so that because Omicron is a highly transmissible variant. So they were put there. Now, what the government also realized was that in many other countries, the hospitalizations, like in South Africa, they went up because people had comorbidities, not so much because they had a very bad case of COVID or long COVID. Everybody mostly exhibited either mild symptoms or were asymptomatic. Now, that is what is happening in India as well.
It is interesting that while Dr. Kang has called for more data, Nidhi says there is enough data shared for the government to conclude its next step. But at the ground level, what is the preparedness? Dr. Alok Khullar, CEO of Gleneagles Global Health City in Chennai, tells me that there has been a spike in cases, but there is hope since there is no clamor for ICU beds like earlier.
We have seen recently a surge in the number of cases coming with symptoms positive of COVID, and it has picked up significantly. So if we had like say 4 to 5 patients COVID positive who were admitted in the hospital, that number has almost gone up to by about 40%. And the number of mild cases that we see, people presenting with fever, body ache, sore throat, that also has gone up in the fever clinic. But we are expecting more to come in the coming days.
And even the 40% seems much less right now compared to what you all faced in Delta. How bad was it in Delta for you?
We were overwhelmed completely because we were catering to 100 positive patients plus another 10 or 20 who had recovered. So that was the peak of Delta. That's where we had challenges in terms of also maintaining manpower to take care of all these patients, to make sure we have adequate drugs and consumables available, to make sure we monitored our oxygen consumption very, very carefully.
Right. How are you preparing yourself for the deluge of patients that is going to come?
So we started monitoring the situation when the surge started in South Africa. We have been conducting regular meetings to say what we are going to do going forward in terms of screening. We have asked all fever patients to report to a fever clinic which has been set up outside the emergency. So people with carrying a potential infection don't enter the hospital. We are also looking at the admission protocols, who needs admission, who can be quarantined at home. Apart from that, we are segregating the area where COVID patients will be treated. We have done that in the past also. So our regular patient care does not get impacted because of COVID care. So there are entry protocols in place in terms of anybody having fever, having to report to a certain area.
There are states which have said that if you are a hospital staff and if you are suffering from COVID right now, isolation is just for 5 days because we are expecting the healthcare system to again collapse.
Since we are not able to differentiate which ones are Omicron, we are still following the old guidelines, which used to be 7 days. 5 days is specific for Omicron.
It's strongly etched in everybody's memory, the need for oxygen, the need for medicines and all. Have regular oxygen recce's be done in hospitals like yours? Are you in touch with other hospitals as well in the city who can help each other out?
Large facilities like ours, we have our own liquid oxygen plant, and it is refilled by a supplier who's authorized liquid oxygen supplier. We maintain regular checks of that particular parameter. Talking to other hospitals doesn't really help much when you're looking at a liquid oxygen plant, but you can definitely arrange oxygen cylinders also. Last time in Delta, I'll just mention, the government had put in place a very strong mechanism to look at oxygen requirement using a nodal officer. And they used to make sure oxygen was available in terms of refill of the liquid oxygen plant. Oxygen is only one part of the story. You need to have the infrastructure, trained doctors, trained nurses and staff to handle this surge in patients. And it is not just the infrastructure, it is also the people who are going to treat these patients.
States have their own COVID task force now. Are there more interactions with the hospitals?
They had set up like a COVID nodal officer for each and every hospital. So we also have a nodal officer who's a doctor who works with us. That person is constantly in touch with the government authorities and they keep passing instructions and queries back and forth. Even now, those conversations are happening on how many beds we have, how many ICU beds can be provided, how many with oxygen, how many with ventilator. Apart from that, I think one of the primary things is the calamity depends on how public and all of us actually behave. If we all make sure we have adequate precautions, we wear a mask, follow all the guidelines and regulations, less and less people will become exposed.
Do you think we are more prepared than we were in the last 2 years?
On one side, the people have become exhausted of wearing a mask and being scared of COVID. That is the worrying part because people are not taking adequate precautions in public places. On the medical side, yes, doctors and nurses have treated thousands of patients now to know the treatment protocols, to know the isolation protocols. Yes, we have also learned to use our resources much better to serve a larger number of patients for better outcomes, no doubt about it. But this can very quickly be overwhelmed if a very large number of people get exposed and infected.
You heard the measures in place, but along with that, there were pleas as well to take all precautions. Thank you, Dr. Kang, Dr. Alok, and Nidhi for the detailed analysis. While the onus is on each one of us, a question to our political leaders across party lines. While curbing movements, shutting down classrooms to prevent a calamity, why continue with election rallies for votes? Are our political leaders not responsible for India's safety?
Well, politicians, several of them have come out to say, especially no prize for guessing from poll-bound states, that Omicron spreads fast but is weak, just like any other viral infection.
2022 is a key election year in India. 5 states are going to polls in February and March: Uttar Pradesh, Uttarakhand, Punjab, Manipur and Goa. The campaigning has already begun. Thousands of people packed together. Not all of them are masked. Not all of them are vaccinated, I dare say.
There seems to be no curfew, no ban whatsoever on political rallies. The Election Commission today had a briefing from the Health Ministry. No decision has been taken by the Election Commission on whether or not to ban these political rallies. The problem is this: we have seen a repeat of this in early 2021. Could we end up making the same mistake as we did last time around?
So in UP specifically, not in the other 4 poll-bound states, we are seeing some measures begin to happen. Congress obviously cancelling all election-related events, and Yogi Adityanath, the Chief Minister, cancelling one event in his Noida rally today.
You were listening to Is India Omicron Ready on the Morning Brief? With me, your host, Devina Sengupta. Producers, Diya Rekhi from The Economic Times and Varun Kapahi from Awaz. Sound editor, Swati Joshi from Awaz. Executive producer for the episode is Arijit Barman. The Morning Brief airs every Tuesday, Thursday, and Friday. I hope you enjoyed listening to the episode. Follow us and do share the episode on your social media handles. The Morning Brief airs every Tuesday, Thursday, and Friday. All clips used in this podcast belong to their respective owners. Credits are mentioned in the description.